If you're having knee problems, here's something that's really going to help you. I'm going to show you a few different things you can do. We're going to help increase mobility. We're going to break down the fascia, the tissue, scar tissue, adhesions. This is really important because this can help many of your conditions instead of doing anything invasive. So the first thing that we're going to do, we're going to address the muscles around the knee. And this is a myofascial release tool that we use quite often. I've used this in practice for many, many years, but most of you are not going to have this, although you can get smaller ones, they're not expensive, or you can use the edge of a fork or the edge of a spoon. Make sure the edge is not really thin. The thicker the better. As you see, this is thicker. We don't want anything too thin. So what we're going to first do is we're going to apply an emollient. This is a massage oil. You can use almond oil, you can use coconut oil, whatever you like. I like to apply it around the knee. So after we put this on, just put a drop on, a little bit. This is going to allow us to have that sliding motion to where we're not going to have any resistance on the skin. So once we have our lotion set, we're going to take the tool and we're going to put it on an angle, not directly on top, but a little angle. If it's 20, 25, 30 degrees, it doesn't really matter so much, but the key thing with this technique is you don't want to push hard. It's real shallow. For example, the quadricep muscles attached to the top of the knee, but right around the top of the knee area, if you push down, you really feel something real gritty, just going light. Where it's gritty, those are usually adhesions. So what we would do is we would just lightly stroke it like this. Okay, now what we're doing here is we're going parallel to the muscle. But a trick is that whenever you have adhesions, it's good to go perpendicular to the muscle too as well. So as we do this, and you'll stroke it about 10 times, not too hard. It may start to turn a little bit red, and that's it. So once you get the other areas, you can start going on angles. If you feel that grittiness in there, and then you can go to other areas right above it. This is what you're going to do. Just stroke it nice and easy. And as you do it, it may be sore. You can come off that area, go to a different area, and then go back again. Remember, perpendicular to the muscle. So whichever way the muscle is, going across the muscle is very, very effective, as well as going on different angles. Now, many of you may find it easier to start on the lower part than work your way towards me like this, which is okay. So if I went this way, went parallel, perpendicular this way, it's all good. Now, there are many muscles from the hip, particularly the sartorius muscle. We have the gracilis muscle, the muscles that cross the knee joint. So if you're having knee pain, you have to address these muscles because the muscles are excessively contracted or imbalanced because your pelvis is off or the hips are off or your gait is off, you're not walking correctly, or let's say you're spending a lot of time sitting, or you're doing some type of athletic event, you're just going too hard and you could have hurt yourself. You want to address areas lightly around the knee. You don't want to go on the bones, but you want to go around the knee. There's a lot of different tendons in there, but you're mainly going to be on areas where there is soft tissue. For example, on the outside of the knee, you've got the hamstrings, you've got the abductor muscles, the tensor fasciae lata, the iliotibial band. And if we come across here, and obviously you can work higher up, all these muscles and tendons are all attributed to the knee because they attach to the knee joint or below the knee joint. So you really want to make sure you spend about 5 or so minutes kind of searching for different areas where you may find those grittiness and adhesions. So same thing here, if it was a spoon, okay, parallel, perpendicular, you can go on angles. And you'll notice once you start to release that grittiness, it starts to get smooth again, which is kind of exciting because then you know you've done something. Breaking down adhesions. Adhesions within the muscle, you have areas, you have areas within the muscle that actually glide. And when you build adhesions, it keeps that gliding from moving smoothly. So by breaking those adhesions down, you get that function back. So here is your spoon. Fork, same thing. I like it nice and wide. You can come on the fork. You don't need anything fancy, but you must have a good emollient, a good type of lotion to allow it to glide. Now you'll notice if you see this, it gets a little bit red, which is good. That's increased blood supply, hyperemia. Okay, you've got a lot of stuff going on, but you're going to notice that once you free up all these muscles, and you're going to see a huge difference immediately when you get up. Now, one of the most important lessons we can learn here is how we can make sure that the kneecap is mobilizing, particularly when we walk, when we sit, when we do our activities, when we play sports. This is a big, big problem that's overlooked. And I want to address it, and I'm going to show you how to fix many of these problems. The kneecap, which we call the patella, is a freely movable freely movable bone. And by the way, I want your leg to be relaxed, not contracted and tight. If you contract the quadriceps, it's going to go down. You'll see the quadriceps will contract, but I just want it nice and loose on your heel to where when you touch the kneecap, it should be nice and loose. If it's not loose, it means you're tightening the muscles, but just relax everything. Now, here's what we need to do. We need to check the kneecap. It needs to move down inferior, up superior, that way which is lateral, and this is medial towards it. And what you want to do is you want to check the kneecap to make sure it's moving in all the directions. Also, you want to make sure it's moving this way and this way. So 8 directions. Down, up, in, out, angle, angle. It needs to move in all those different directions. And if it's moving in all those directions, there's not a whole lot you need to do. But everyone, when I say everyone, 99% of the people, including myself, can find an issue here because we can develop adhesions underneath the kneecap, which can start allowing it to stick. So when we walk, the kneecap's not moving. Now, why is that important? Because you have important muscles, the quadriceps, attached to the top of the kneecap. And every time you walk or contract, if you're sticking underneath that kneecap, you're causing inflammation, you're causing dysfunction. You can lead to degenerative joint disease, arthritis, problems with inflammation, and that can really set off a whole cascade of problems. So here's what we do. We want to check mobility. As I go down, remember, it has to be loose, relax your leg, down and up. Okay, as I go down, look at my kneecap, it moves good. But watch when I go up, it's locking. It's not moving good here. Okay, we'll keep that in mind. Now I'm going to come out lateral. It's moving okay, but watch what happens medial. Much easier. Okay, and then we'll go on diagonal on both sides, and it's moving good on the diagonal outwards, but as I come up again, it's locking because that superior, that area that I checked this way is not moving. So anytime you go in those same directions, you're going to have limitation or fixation. And as I go this way, and as I go this way, still locking because of the superior area is not coming upwards. It goes down fine, but not coming up. So how do we fix it? The areas that are not moving are the areas you want to put impulses into. By putting impulses, you can release it. And once you get it, you have it. It's that easy. So what you do is you take your thumbs, you take your middle fingers, and you'll wrap it around, as you see right here, and you can take your thumb wherever you want to put it, but you want to kind of relax everything else, and then when you pull the tension, you're going to pull the tension out, and then you're going to do a little impulse, just like that. Okay? Sometimes you hear a little click in there. It's a joint. Okay? Pull the tension, impulse, impulse. So you can do a few of these impulses, and right after that, let's check mobility, because I felt the release in there. Look how it's moving now. Huge difference. Huge, huge, huge. Let's check the angle. Okay? See how it's moving here? Perfect. So right now, it's perfectly moving. I had no mobility going upwards, which I'm glad I didn't, because you can see before and after. So if I bring it downwards, and let's say it's locking, what do? Take your thumbs behind it. I'm just telling you in case you have this issue. And take the tension out. Look, tension out. Push on it, tension out. And then impulse, 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 then recheck. Okay? If it was going laterally, you take the tension out, however you want to use your thumbs. Watch my thumbs, impulse, impulse. If it was going medially, okay, thumbs on the outside, this got to be relaxed, impulse, impulse. Once you do that and you free up this patella, I promise you, you are going to see like miracles, not tomorrow, like right immediately. That's how exciting this technique is. So in summary, here's a few things we need to do. Number one, address the knee. If it's inflamed and swollen, yes, you want to use ice. But if you notice it's gritty in these muscles, definitely try to get that grittiness out. A little bit of scraping, superficial, don't push deep. It should not hurt you, and do not injure yourself. Remember, never go over bone, only soft tissue. Wherever it's hard, stay away from. Then we'll check the patella, making sure it's mobilized, making sure everything's moving correctly. And you can do this as often as you need to. But you'll see this will really do wonderful things for you, because the patella is probably one of the most commonly, number one, overlooked condition with knee problems. Remember, all these muscles attach into the kneecap, and if you have imbalance in those muscles, it will throw the kneecap off, which will lead to a lot of dysfunction. So please share this video with your friends and family. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.